I will get us started. So thanks everybody for joining us for our quarterly DHS OCI Healthcare Coverage Partnership Forum. This is one that we had rescheduled. We pushed this back a few weeks to make sure that we were able to compile as much data as we could from the results of our open enrollment efforts. And so we have a lot of great statistics to walk through at the end of our presentation today. That'll be the final major item. So I will get started. Oops. So this is our agenda for today. So we're going to walk through a little bit of the partnership history and overview. I know there are some people on today this may be your first partnership meeting or only your second or third and need a little background as to what we're doing here today, what the intention is. We have a few comments from Department of Health Services on unwinding and some key messages on that. We have a work group report section where we will have some of our work group chairs share some updates on the work that they've been doing recently, and then a recap of the open enrollment period, as I mentioned. So first, just really quickly on the history of this partnership. So Governor Evers launched the DHS OCI Healthcare Coverage Partnership in 2019. This was aimed at enrolling Wisconsinites in high quality and affordable health insurance coverage. It has a focus on outreach and enrollment and was really intended to engage a wider audience of stakeholders. So everybody from our consumer and community organizations, health insurance companies, health systems, of course, our state agencies here at OCI and DHS, and those across the spectrum who have some connection to the health insurance and coverage space, so that we could be as coordinated as possible to continue reducing our uninsured rate here in Wisconsin. And so this partnership is overseen by a steering committee. The steering committee is intended to provide leadership and decision-making for the work of this partnership. It's a number of subject matter experts that come together on a regular basis to kind of coordinate and plan for these forum meetings and make sure that we understand what's going on in each of the work groups that are part of this partnership. It also is an opportunity to ensure that DHS and OCI have feedback early on in the process if work groups are interested in pursuing a particular initiative or project that might require agency staff or funding or other support, so that we can, provide insights on whether that's possible sooner rather than later. So the steering committee consists of the work group chairs then, of course, and then representatives from DHS and from OCI, so that we can evaluate the work that they're doing and help provide insights and decisions from our agencies. So this is a really quick overview of how that's structured. So the Partnership Executive Steering Committee, the Partnership Forum, where we are now, is sort of a kind of intermediary, so that there's feedback up through the work groups, but also kind of driven by the decisions determined by the steering committee members. We also have the regional enrollment networks. So I don't have on this chart right now our outreach and enrollment work group. That's a work group that we've had for a couple of years, but based on recent discussions, it may be more appropriate to move some of the work of the outreach and enrollment work group into the existing structure of the regional enrollment networks. So that sort of structuring is still somewhat in flux, but we have really thriving regional enrollment networks here in Wisconsin. I know many of you are probably part of those already, and we'll touch on them a little bit later in the presentation as well, but they do interact and participate with the partnership as well. So just really quick on what this partnership has been able to achieve so far. It has expanded really rapidly since its launch. So again, it was only launched a few years ago. And the email list for participation that you are all a part of, if you've received this meeting invite, is over 250 people now. So we take that as a really good sign that people are interested and want to participate, learn about what's going on during these quarterly forums, and have this opportunity to provide their feedback on the work that we've been doing. This has allowed us to improve coordination across all of these groups, which was really the intent of the partnership, as I mentioned, and allowed us to really quickly pivot efforts during the COVID-19 pandemic. And certainly the SEP that we had in 2020, as it would have been 2021. And then of course the open enrollment periods as well, but to make sure that we were responding appropriately as things have come up. And the work groups have each undertaken a lot of different projects. So this is just one example. All of the work groups have all had successful initiatives over the course of the partnership so far. But for example, one that we'll touch on later, so you have some context for it, is the wiscover.com resource. This was a resource that was spearheaded by the partnership's marketing and promotions work group. It is managed by OCI, but all of the content on it and its intention, what is all driven by the marketing and promotions work group. It stays up year round, but we pivot the information during the open enrollment period to really drive consumers there during that short time to make sure that they get connected with experts that can help them enroll in coverage and provide reliable information. And then year round, like I said, it stays up, and so that we can provide information to, for example, Native folks who have the opportunity to enroll regardless of open enrollment periods, and other information about Badger Care and other opportunities for coverage that people may qualify for. So with that background, on the background of the partnership, this is a DHS and OCI partnership. Our next section is the Department of Health Services, and I believe Jamie is calling in. So if Jamie is on the phone, I would ask if you could try to unmute yourself. You should be able to unmute with *6 if you're on the phone.
Sarah, can you hear me? This is the call-in user, but I'm not Jamie. So you asked me to unmute. I just wanted to let you know. Thank you.
Okay. Oh,
Sarah,
it looks like Jamie has joined as a panelist now. So sorry about that confusion.
It just says that I cannot start my video, so it should work now if you want to unlock that.
Yeah, we can hear you. So I think you can speak if you'd like to, and if I make you a co-host, you should be able to start your video or share your screen as needed.
All right. There we go. Okay. Well, thank you, Sarah, and thanks everybody for letting me join today. I'm not going to be going through any slides as DMS. We are working very diligently to make sure that all of our materials are in sync. A lot of what I am going to go through today, though, is online at the DHS website regarding unwinding. And I know that there have been a few changes since you all met in October. So I'm going to try to focus on those, give a high level summary of things that you can find on our website. And if there are questions afterwards, obviously more than happy to answer them later, or however is the most convenient for everyone. So just again, because I am new to this, I just want to introduce myself. I'm Jamie Kuhn, the new state Medicaid director. I have previous to this, I was working for Governor Evers in his office as the external affairs director. And I've spent a number of years in state and local government working on healthcare issues. So I'm really, really excited to be here. I think we all share the same values in regard to, making sure that we are doing everything we can to outreach to individuals, whether they are our members or not, and ensuring that people are enrolled in the healthcare that they are eligible for, and working with them to make sure that they understand the programs and that they have access to those programs. So thank you. Again, I'm just going to try to level set a little bit quickly here, because I'm not exactly sure who all has been on this before and who is new to this, but just so we're all using the same definitions. I'm going to use obviously the term unwinding to define our 1-year process where we are for the states to return to routine pre-pandemic operations in Medicaid. And as you all know, This is a 12-month process. So once it begins, the federal government has given us the 12 months to unwind, and hence the word unwind. So since you all met in October, a couple of things have happened. The Consolidated Appropriations Act in December passed in December, decoupled our continuous Medicaid coverage from the public health emergency. In addition, in January, on January 30th, the federal government also announced that the public health emergency would end on May 11th. So we are operating under those timelines, which is more concrete than it was in October when you all last talked. What that means is at the end of this month, the additional emergency allotment of food share will return back to pre-pandemic rates. And it also means that we will begin the unwinding process as of April 1st. So nationally, and not just in the state of Wisconsin, as you all know, this is kind of an unprecedented event. And what I can tell you, even though I just started, is that DMS and DHS have been working for over a year with all of our partners to ensure that we are prepared as best as we can for this unwinding process. And obviously our vision for successful return to pre-pandemic operations is really about mitigating the negative impacts on members and partners. So as of April 1st, unwinding for continuous coverage will begin. What that means is for existing members on March 31st, states must begin a full eligibility redetermination. And for most, redeterminations will occur during their next renewal. But in line with CMS guidelines, renewals will be distributed evenly over that 12-month unwind period. Any new applicants who apply for Badger Care Plus or Medicaid on or after April 1st will be subject to normal termination rules. So again, the earliest any member in Wisconsin would have a change in coverage based on our timeline is the end of May. And that is because as of April 1st, we will start the unwinding process. We are also working really, really diligently to make sure that we are aligning our renewal dates within the household for other programs such as food share and child care, if applicable. So those are sort of the dates that we're focused on, but want to just give you really quickly some communication updates as to how we're operating. And again, there is a lot of this available on our website. We are trying to consolidate and we are trying to update it as quick as we can before we start unwinding so that all of the information is in sync. So if there's something that you hear today, you want to double check it on the website. Most of it is updated as we online, but we are continuously updating to make sure that we have the most updated information online. So all members in March will receive a one-time letter informing them of their renewal date. So this is sort of an important piece as we prepare for unwind for April 1st. We are doing as much communication as we can in advance of that. And mid-March, they will receive a hard copy letter about their renewal date. They will also then receive a second letter approximately 45 days before their renewal date. So as we discussed previously, not everyone's renewal date is going to be right away. We are going to spread it out over that 12 months, but everyone will receive a letter in mid-March saying when their renewal date is. And we are asking, as you all have probably worked through some of this already, though, we are asking that folks not renew before their actual planned renewal date in that letter. And that's just to make sure, again, that we spread it out, that people are informed as much as they possibly can. and that they don't lose coverage before they are scheduled to do so. That they do not, let me rephrase, that they are not moving or transitioning between coverage before they need to. We do know that this is going to create an additional workload for a lot of our income maintenance workers. And we, as I will address in a couple minutes, we are doing everything that we can to mitigate that workload increase. So there is a member communication timeline, and it is located on our page at DHS Keeping Wisconsin Covered. So again, please go to our website. Everything that we can, we are updating as quickly as we can on that website, and information is available there. But there is a member communication timeline on that website that you can utilize that lays out some of these timelines. In addition, we have a partner toolkit on unwinding as well at our website, and that is literally on our unwinding toolkit link. So please go to that. All of our resources, and again, as we talk about how important it is to ensure that our members have access to the information they need if they were to transition during this process and in need of additional services or different services, this is where we can continue to collaboratively educate our members. We will be sending out and utilizing text messages and emails as well. So our letter is not the only form of communication that we have with our membership as well as with our partners. So keep an eye out on that. And we also have a renewal web page that we are working on, and is really designed to help the member understand more about this process as well. As you all know, we also do have a secure online web portal called Access that we are encouraging members and others and potential new members to utilize as another tool where there is information available for them to either renew their benefits or enroll. Another tool for you all to utilize is our Forward Health Provider Toolkit. You can find that again on our Forward Health page. So if that is where you are receiving most of your information, you can also go there. And there is also a toolkit there that you can share with members or others to find additional information about unwinding. But again, I know that many of us and many of you have already had conversations on a pretty regular basis with our team, and we are always continuously updating the information as it comes in, but making sure that is consistent across platforms, which, as you all know, can be challenging sometimes. But the most important thing I think that we want to get across really is about making sure that we understand that we are doing everything we can to help Wisconsinites maintain health insurance coverage. And so as we go through this process, again, that is our top priority in ensuring that Wisconsinites have access to the healthcare that they need. Thanks, Sarah.
Thank you, Jamie. And for everyone, it looks like there are a couple of links in the chat. Everyone should have access to see those links that were things that Jamie referenced while she was talking. So hopefully those should be helpful resources. And I don't see anything in the Q&A, but if you do have any questions, feel free to ask those. I think we're going to move on with the presentation, but we do have a section at the end for Q&A as well, if something occurs to you. So thanks again, Jamie. Appreciate it. All right, so now we're going to go on to the work group reports. And we have a brief report from the data work group. So I think I'll hand it to Kelsey Avery to share this quick update.
Thanks, Sarah. I think you can hear me, but I'm not, I don't have video enabled here. It's giving me an error sign when I try and turn that on. So I will just proceed, and then if I can kick that on at some point while talking, then I will do so. So hello, everyone. My name is Kelsey Avery. I am Director of Policy and Association Operations at the Wisconsin Association of Health Plans. I am the co-chair of the data work group, along with my colleague, Nick DeMeo, who is a policy advisor within the Division of Medicaid Services. And I've talked at this forum before about two information products that the data work group has been working on in collaboration with our agency partners. And a description of these two dashboards is provided on the slide. And oh, there you all are. Hello. And you can see from the descriptions that are on the slide that each dashboard serves a different purpose. So the first dashboard is meant to give the public an easy to digest broad view of healthcare coverage in Wisconsin. And the second dashboard is meant to give key stakeholders in the unwinding effort, which Jamie just talked about, a resource to inform their outreach and communication strategies, again, with the North Star being helping Wisconsinites remain covered in the coverage that they are eligible for. So our efforts have been dedicated to both developing these dashboards and then developing related products in preparation for these dashboards becoming accessible and rolled out. And we're really looking forward to finalizing these, and we're going to continue to share updates at these meetings on our work, and stay tuned for some bigger news in the future. So thanks.
Great. Thanks, Kelsey. Looks like maybe a couple people had trouble hearing you, but I could hear you. So I think we got it on the recording at least. And we always put the recordings up on our website after the fact. So if you did miss what Kelsey was saying, that will be in the recording available on our website later this week. So, all right, thanks again. So now we're going to touch on the outreach, education, and networks. So as I mentioned before, we'd had a outreach and education work group, and we're sort of in flux on maybe adjusting or removing the outreach and education work group and moving to focusing that work into the regional enrollment networks, which already exist and already do a lot of that outreach and education work. So we will jump into this section, and I'm not sure who I'm handing it off to on this. Is it Carolyn?
Yeah, Caroline. Yep, that's
Great.
me.
Perfect.
Wonderful. And I don't know if folks can see me. Looks like I can't turn my video on, but I will go ahead. So as part of the DHS OCI outreach and education work group, we're calling it kind of a merger of the outreach and education with the statewide network, enrollment network work group, to form what we're holding right now is outreach, education, and networks work group, but we're going to come up with a way better name in a short amount of time, I assure you all. But the enrollment networks are creating natural venues for conversations right now about outreach and education happening across the state, as well as capacity building for enrollment assisters and streamlining messaging that's shared with us with the communication work group as it revolves around Medicaid renewal unwinding period, as well as open enrollment and other areas of support that we can give the communities around access to enrollment and care. Can we go to the next slide, please? And so as of late, the meetings for the enrollment networks have revolved around preparing partners for the unwinding. So we have had DHS representatives attending each of the enrollment network meetings to provide real-time updates on the unwinding. Current agendas have included suggestions about what partners can do now to help members update their contact information, and then what to expect in a few months, with, of course, more information to come both from DHS, OCI, and partners like Covering Wisconsin. And then we've been taking some time of these agendas as of late to also brainstorm and share best practices of outreach and dissemination of information, so that we are really thinking through what strategy we can use during this unwinding. And it's not too late to join. I can't say this enough. We have a really fantastic group of enrollment network leads that I'm so excited to be working with. And don't mind you that one of them is me in the Southwest and Southeast. But we are really excited to be bringing partners together, similarly to when we were rolling out the Affordable Care Act in the first open enrollment period, but now using this capacity and this opportunity to collaborate around this Medicaid unwinding period. And we know that we'll need all hands on deck. So please know that you are welcome, know that we want you there, know that we have work to do and we're still figuring things out, because the majority of the enrollment networks are still, figuring themselves out, because we just stood them up over the last 6 months. But we're here to really make sure that we're doing what's best for our local regions. And then our first ever statewide group, which is the Latino Enrollment Network, making sure that we're reaching our Latino communities in this transition as well. We are working on potentially creating a 10th enrollment network, which would be a Hmong focused enrollment network. And we're currently in conversations with partners to hopefully do so. So look forward to you all joining. The link of this title card is actually where you can sign up for your local enrollment network. So I don't know if anyone can share that either in the follow-up email or in the chat as well, but thank you very much.
Thank you. I think we could probably find it to put in the chat, but it is a live link. And so we'll send out the slides to everybody after the fact. So you would be able to click on that as well.
Awesome. Thank you.
But certainly email the folks here too, if you're kind of interested in those particular enrollment networks. Yes, thank you. All right. So now we are going to jump into the open enrollment recap. This is an open enrollment recap and also an update from the marketing and promotions work group, but it's going to take a little bit longer than the rest of them. So we're going to get started looking at some enrollment numbers. And I don't know, Stephanie, did you want to walk through this slide, or Allison, or I can? I don't know if you had discussed. So
yeah, no, I'm all set to do that. So I just want to say, first of all, congratulations to everyone who worked hard this year to promote open enrollment, to sign people up for a plan, to refer people to an enrollment assister. So we did great. We had over 221,000 people sign up on healthcare.gov. It is our highest enrollment since 2018. As you can see here, we're close to 9,000 more than last year. And what's even more exciting is that if you think about all the people who have had continuous enrollment on Medicaid and this number, we have a lot of people in Wisconsin who are covered by health insurance. So it's a pretty exciting time. I know we were all very excited by these numbers. So just a round of applause to everyone. And I'm sorry, I forgot to introduce myself. I'm Stephanie Sievers, and I work at Covering Wisconsin, and I am the co-chair of the marketing work group. And I'm the insurance literacy and communications manager at Covering Wisconsin. So just to backtrack. Okay, if you could go to the next slide, Sarah. Okay, so our marketing work group works very, very hard to work together on messaging that's going to be statewide. We help each other out. We give feedback on everyone's messaging and layouts and design. We really are putting forth a team effort. And all the work that we did, we added up all of our impressions, and we had over 85.5 million impressions. And out of those impressions, where we had over 300,000 engagements. So I want to just define for everyone what an engagement is. So if you're not in marketing or follow social media, an engagement is anytime someone does something to react or click. So that might be they liked it, they shared it, they clicked on it, they traveled to a website because they wanted to learn more. So that's what we mean by an engagement. It means that someone is actively responding to what we're putting out there. Most cases, our engagements are digital. So, all right, if you'll go to the next slide. Okay, so in a lot of the promotions that we put out there, we send people to 211 or WIS covered. So I want to just talk about what we have for the data for 211. So if you're not familiar with 211, that is a United Way funded helpline. This year they had 715 referrals. And as you can see on this map, you can kind of see what county people were calling from. So we had pretty good representation throughout the state, thinking about where those population centers are. But I'm going to say these numbers are down from the last few years from 211. And that is because a lot more people are going to the online place. If you could go to the next slide, which is WIS Covered, as Sarah mentioned at the beginning. WIS Covered had an over 900% increase of visitors to the website. So we're very, very excited about that. So what does 900% look like? Well, it's 114,747 page views. Out of those, when we look at who went there, we can see that over 43,000 are located in Wisconsin when they go to the page. Now we have quite a few. The majority of the other people who are traveling there are from our border states. So they might just people who travel back and forth during the day for work or live in one side and get healthcare on another, depending on what their situation looks like. So we are very pleased. You can see in the map there where in the state people are coming from when they're in Wisconsin. So a lot of people are coming from our population dense centers in the eastern part of the state, and Milwaukee, Dane County, Fox Valley. But we have some pretty good representation from some of our rural regions as well. And over 1,000 views from the Spanish or Hmong pages of WIS Covered. So go to the next slide. Where are they coming from? We can track that. We know that over 57% came from paid Google ads. So that's a combination of paid search and paid Google targeted ad displayed ads. Over 23% came from a social media site. Over 14% directly typed in the address. 1.7% came from referral, and less than 1% came from an organic search. Next slide. Okay. So how did we get those, what was it, 85.5 million impressions? So let's talk about the work that the members of the work group and our community partners did to get us there. Okay, so one of the things that was invested in was an ad buy through the Wisconsin Broadcasters Association. This is a public service announcement style ad buy. It's part of their public education program. So you get a lot more bang for your buck. It's only available to state entities and nonprofits. This year, this purchase was financed through Covering Wisconsin had money from CMS, but we also had some generous donations from Anthem, Common Ground, and UW Health. Oh, and also OCI was able to chip into this one this year. So we were really excited about that. This ran for 10 weeks. We started just, I believe it was the day after the election. So we're always a little delayed with an election cycle year because there's so much noise that we wait. So we make sure that we can be heard. So we had a TV ad, you might have seen it in both English and Spanish. We had radio ads that were 15 and 30 seconds long in both English and Spanish. And then we had a lot of social media content, lots of videos. And with this particular ad buy, we place something on our social media content, and then they share it then, that post with different radio and TV stations who are members of the Wisconsin Broadcasters Association, which is It's about 95% of the total media sources in Wisconsin. I don't have the data from them yet. As Sarah said, we were still collecting data, trying to scramble for this forum presentation, but I can say that last year, there were 39 TV stations and 176 radio stations in the state. Okay.
Necesita ayuda para apagar su atención.
That was the radio ad.
Yeah, sorry. Apparently when you click
Yeah.
the arrow, it starts
Yeah,
playing
when
on your
you
slide.
get this, when Sarah sends it out, you can watch the ads and listen. There's the Spanish radio, the English ad, and then an English social media post. But and the social media posts were almost nearly all of them were both in English and Spanish. So, okay. In addition, there was a large digital media campaign and also influencers. So I'm going to go through each piece of that. This was statewide. There was digital video streaming. So we tried a lot of different platforms for that. So there was Hulu. Wow. Off the top of my mind, it escapes me. But there was YouTube, a lot of the different streaming channels. We tried various ones to see who was generating the most amount of impressions or engagement. And that's the most fascinating thing with digital campaigns, is that we can try for a week, and if it's not going well, reinvest somewhere else, and really stick our money where it's going to be most beneficial and reach the most people. So as you can see, we had nearly 3 million impressions and over 144,000 engagements in just digital video streaming. There was also digital audio streaming. So that's Spotify. What's the other one that's really Pandora, those types of channels. We had over 721,000 impressions and 1.3 thousand engagements. Audio streaming is a little harder to generate engagements, because usually people, when they're listening to music, they're not necessarily sitting in front of the screen that they're listening to. We had digital display ads through Google. So there were 3.9 million impressions with those, and over 13,000 engagements. And then we hired a variety of social media influencers throughout the state, a lot of young adults, and they have their own channels, and maybe they're popular on their channel on TikTok or another platform. And we gave them parameters, and they created their own content that was often 30 seconds or less, and then shared it on their pages. So with that, we had over 841,000 impressions and 17,000 engagements. And what's really exciting with them is some of them create even better content than we made in our own ads. So we're able to then repackage those and post them on the platforms and digital channels as an ad, because some of them are really phenomenal. So I will say I don't have data to back this up, but I have heard conversationally from a lot of partner organizations this year, including the navigator agencies, that they had a lot more young adults reaching out this year than years past. So we credit that to a lot of the digital media campaigns that were happening. Okay, Sarah. Okay. There was also consideration for rural audiences. What's the best way to reach a rural audience? And we always, when we do a lot of these campaigns, we work with our partners on the ground in those regions. And so there was a decision to place some billboards with different branding, so that the agencies who were on the ground there could help people associate a brand name with the function. So, you know, health insurance enrollment assistance with a particular organization. With those, we had over 6.5 million impressions. So that's still initial data. Some of it was guesstimated, and often we get more than what they guess. So we're excited to see the final data on that. There were also 159 ads placed in 24 newspapers throughout the rural sections of Wisconsin. And again, we worked with community partners on the ground to determine what parts of the country and what publications. So Of those, they had a circulation of 243,609. So those directed people directly to the agency on the ground or enrollment assister. So it might say an agency's name or specific name and number of a enrollment assister. And as you can see, there's one here that was placed during hunting season. Again, always working with our on the ground partners to think about what's happening at that time of year and what might catch the attention of the local readership. Okay, and then we were able to place bus placard ads in 3 different metro areas. So that was La Crosse, Madison, and Milwaukee. We really wanted to place them in Green Bay, but it didn't work out. So we had a total of 27 bus placards and we had over 20 million impressions. So you might see some of the ads are really meme-ish in style. And again, that was, it was intentional thinking about some of the buses drove through college campuses. They're really just trying to catch the attention of a more young adult audience. Okay, so the Milwaukee, of course, is so large and populated. It has its own targeted promotions that happen on the ground. And a lot of that is done with our partner through MCAN. So who are very active in our marketing work group. So the impressions of their digital campaign, they did a large digital campaign this year. They had 8 channels that they ran ads on. There were 28 ads placed and over 7.4 million market impressions. And over 49,000 engagements. So of course, that's added to our total 85.5 million that I'm really excited about. And then lastly, something unusual that they did this year that was very exciting is a lot of the artwork and the messaging was very art and artistic. It was beautiful. And so they printed out large poster sizes of a lot of the ads and beautified the neighborhoods that had a lot of boarded up houses and businesses. Really trying to grab people's attention in a unique way. That was very much grassroots community driven. So, okay. And then Fox Valley had its own focus as well. So there was a variety of different things that happened. There was Google ads, there was Spectrum streaming, Spectrum cable, because since Fox Valley has a lot of rural parts that really abut against it. And a lot of people using the healthcare in the Fox Valley are coming from rural regions. So there was a more of an emphasis on cable TV. And then radio, there was 3 different stations that ran radio ads and then also billboards. So as you can see, we got some nice impressions on all of those different ad placements. Okay, and then 3 different agencies in the state had toolkits, which were shared widely. So OCI had their toolkit. So they emailed the toolkit out to their contacts. So they sent out more than 1,900. They had over 1,000 website visits. It was available in English, Spanish, and Hmong. And we saw a lot of usage of the OCI toolkit by elected officials and public agencies and departments. So that was really nice. Covering Wisconsin also created a toolkit that's available in English and Spanish. It was emailed out to the over 4,000 member listserv, and they had over 1,500 visits to the website. And all of this was during, I believe, October to the end of open enrollment. So we had lots more, all of us, before as well as people were preparing for open enrollment. And then MCAN had sent out emails to their 2,000 plus member listserv and had over 921 visits. And that one was available in English, Spanish, and Hmong as well. So, you know, the toolkits have lots of resources that are really, really helpful. Social media posts, graphics, videos, GIFs, flyers, outreach cards that can be, in some cases, co-branded and personalized. So it's a really great resource for community members and those of you who are referral agencies. Okay, and then there was a series of press events led by OCI, and they worked really hard with various agencies on the ground who help with enrollment assistance. So there was La Crosse, Green Bay, Madison, and Appleton. And there was also a series of press releases and a lot of different articles that were generated as a result. And here's the huge list that no one can possibly read. But when you get the slides, there are links to all of those different articles. And then the most exciting is that those 26 times of third-party media are not the whole story. We have a lot of examples of more localized regional interviews that happened as a result of all the press and attention that started with those press events and these press releases. So we thought it was very, very exciting. We weren't able to track all of them, but the ones specific to the OCI releases we were able to track. So okay, and I will let Kelsey take over.
All right, thanks, Steph. Can everyone hear me okay? Okay, thanks. So my name is Kelsey McDermott. I'm an advanced communication specialist at OCI, and I co-chair the marketing and promotions work group with Stephanie. All right, so our campaign was informed by the market analysis report, which was conducted using state flexibility grant funds to evaluate enrollment in the Affordable Care Act, other coverages, and the uninsured population. So our campaign that I'm going to go over today was funded by both CMS and OCI. So we had billboards, social media, including Facebook, Instagram, YouTube, Reddit. We had bus ads, Spotify, streaming ads, Google search ads, and radio ads. And here's some examples of our creative. So some bus placards on the bottom, billboards, social media, and then one of our YouTube video ads. Thanks. And here's our digital media ads with total impressions of 11 million, and that's including YouTube, Facebook, Instagram, Reddit, Google paid search, and Spotify. Some examples of our ads. Next slide, Sarah, thanks. And here is some of our other media. So we've got our billboards, radio, and bus ads with over 7 million impressions from those. That's all I have from OCI.
Okay, so what's next for the work group? Oh, the unwinding, of course. So the work group, we're approaching the unwinding from a slightly different framework than DHS and their partnership forum, as we're not addressing members who are going to lose coverage. We will be addressing the public who might be thinking, I lost my coverage, or I'm going to lose my coverage, and what do I do? So a lot of, we'd like to call that SEP promotions, special enrollment period promotions. And so we're planning for that now. We're focused on the next round, which as Jamie mentioned, so the first round of people are going to lose coverage in May, and a lot of people are getting their letters in March. So we hope to start in April and go until October. So it's a 7-month time period. we know that once open enrollment promotions start in November, we kind of scoop up everyone who's worried about health insurance anyway with those promotions. So we really want to focus on that April to October timeframe. So we're looking for any financial donations to help us as a group and a team extend what we're all able to kind of chip in with our different agencies. And any grant funding we can leverage. And I did forget to mention with Covering Wisconsin, we also had some funding from DHS that chipped into a good significant portion of the ads we were able to run. We also need your help, not just if you can help chip in so we can help spread the word. We need you to share the social media posts. So if you follow OCI, Covering Wisconsin, and MCAN, that's a great place to start. We all post fairly regularly. At least we'll start to again in April. And we post regularly enough that it's quite easy. You know, a new post, you'll get a notification and you can just share it. And that would help very, very much. We try to get our posts to go viral so more people see them. As the toolkits become available, we're all scrambling for toolkits right now. As they become available in the coming months, please make use of them, share them with other agencies or community organizations. Covering Wisconsin has some printing budget. If you want to share resources but don't have money to print, reach out to us and we'll see what we can do to help you with that. As you need to, please make referrals to your local assisters. And you can reach out to Caroline Gomez-Tom for a little bit more help with that as part of the REN work. They're very actively engaged in that. So find out who your local assisters are and make referrals as needed. You know, enrollment assisters can help people figure out if they need to renew, if they need to reapply, if they need to maybe change their coverage. Maybe some people are going to be eligible for an employer-sponsored plan, and they can really help people sit down one-on-one and help people work through what their next steps are. And lastly, join a work group, promotions work group, maybe the education outreach and networks. Did I get that name right? The current temporary name work group. There's the data work group. So join a work group. I listed the contact for the promotions work group here because we had a huge report out this week or this forum. So join us, let us know, and we're excited what we're going to be able to produce for the unwinding.
Thanks, Stephanie. All right. So now we are just wrapping up the meeting with questions and feedback. And I haven't seen any questions come into the Q&A that we haven't already answered. So I'll jump to the next slide. If anything occurs to you, throw it in there really quickly. But again, we thank everybody for participating in this partnership and being with us today. Currently, the next forum is scheduled for Monday, April 24th at this 2 to 3:15 timeframe. And we will be sending out the slides to the group after this as well. And the webpage that I believe it was Kelsey put in the chat to all of the recordings. So if you want to share today's meeting with anybody, or if you want to recap any past meetings, those recordings are all available on our website as well. So, and I don't see anything coming into the Q&A or the chat, so I think we can wrap it up. Thanks everybody for your time today. Appreciate it.